write this book? And
I write this book. It means that you can do big surgeries from head to toe without putting the patient to sleep.
That's fantastic.
Yes, it's just like acupuncture. If you know where the sensory nerves are and where to block them, you can have big procedures, like for example hair transplant. I can block the whole scalp with a few, let's say 10 milliliters of anesthetic solution.
And the patient is awake.
And the patient is awake, but there's no pain.
That is great, Doc. And this is still using the traditional way, but with modification?
Yes, with some modifications.
All right.
Let's talk about the new book that's coming out.
Okay, and you're writing a new book?
Yes, I'm writing a new book. That is my fourth book. And the title is, this is my first book about nose rhinoplasty. Now I have, I'm coming up with a fourth book, which is a lot better than this. It is No Sleep, a guide for aesthetic surgeons. The reason is I want to put out principles, mainly to have safety in doing these procedures. As you know, this is one of the most popular procedure now, most frequently done, and the complications are increasing because there are some, because the practice is lucrative. There are some shortcuts. For example, a doctor who is working or practicing in another specialty decided to observe and then practice cosmetic surgery like no sleep. But I can tell you that it is like you have to learn, you have to study, you have to have a structured program, a guided program, and you have to have hands-on training, and it takes years before you develop to be a competent surgeon, plastic surgeon.
In short, only go to the best. Don't fall in the hands of quacks, correct?
Right.
And there are many who pretend to be plastic surgeons and they are not. So check the doctor's credentials before submitting yourself to any kind of surgery. Doc, how many, candidly speaking, how many noses have you done?
I would say thousands.
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 And in all this time, what have you learned about doing Asian faces?
Okay, I told you that most important is safety. Second, excellence of work. You have to have that passion for excellence. To me, excellence, as you will see later, that preparation, you know, it's analysis, planning is the critical part. The execution is fast.
All right. Now, if a patient insists on a nose and brings you the photograph of a movie star, will you do it, or will you tell her something else is better for her?
Okay, it's like this. I will be honest with you. If I see that I can do it, I will do it. But there is such a thing as the anatomy of the patient. If you have this patient and there is a risk that you can perforate the tip of the nose particularly, that is the most frequent area where perforation occur, then I will tell the patient there is a limit to what is safe.
That's right.
Because what you are going to put in, although it is inert and biocompatible, it is a non-living tissue. And your nose is a living tissue. So it is your nose which will give way. It is not the implant.
See.
Many people...
The implant is forever.
It is forever, okay? It will not die.
But our bodies are not.
Right.
That's right.
So you have to explain to the patient.
Okay. Thank you so much, Bill.
You're welcome.
And that's a good interview. Very good.